In this video, we're going to talk about disorders of puberty, how to work them up, and a bit about management. We have to start by defining a few things. Let's begin by talking about precocious puberty. Precocious puberty is defined as puberty less than age 8 in girls and less than age 9 in boys. And puberty here means development of multiple secondary sex characteristics. It's important to note that isolated or single sex characteristic development is not always abnormal. In fact, early but isolated pubertal changes are normal. This would be like just a bit of acne or hair development by itself, and that typically just requires monitoring. In girls, there's usually not an identifiable cause of true precocious puberty. These cases are usually idiopathic. In boys, however, there's usually an underlying etiology, and that's where the workup comes into play. Workup of precocious puberty consists of labs and some imaging. To begin with, you're going to want to get an FSH and LH, estradiol level in girls, testosterone in boys. They all need a TSH. And they all also need a bone age x-ray. Some patients also require an MRI. This includes all boys with precocious puberty, girls under the age of 6, and any patient with neurological symptoms. Now let's talk about the opposite end of the spectrum, or delayed puberty. Delayed puberty is defined as no breast development by age 13 in girls. In boys, it's no testicular development by age 14. Testicular development is defined as a testicular volume of 4 cc's or length of 2.5 centimeters. The most common cause of delayed puberty is something called constitutional delay of growth and puberty. Constitutional delay of growth and puberty is abbreviated CDGP. The workup for delayed puberty is actually the same as precocious puberty. FSH, LH, testosterone or estrogen level for boys and girls. They're all going to get a TSH and that bone age x-ray. They do not need neurological imaging. In these situations, in some situations of CDGP or delayed puberty, you may treat with giving sex steroids, and that triggers puberty. This isn't a case-by-case situation, and not every patient with delayed puberty or CDGP need treatment. So again, CDGP is just the most common cause of delayed puberty. This is what we think of in the community as late bloomers. Typically it runs in families where they can say that the girl's mom or the boy's dad also were a late bloomer and developed pubertal changes a little bit later than their classmates. These kids typically have a short stature that is non-congruent with their family, so they're small but their parents are of normal height. They also have delayed onset of the time of pubertal changes to begin, but then all of those pubertal growth spurts are also not happening. So they're slow to catch up with everything, the secondary sex characteristics and the growth. If they got a bone age x-ray, which is part of their workup, it would show a delayed bone age, so they would even look young on the x-ray. This is usually self-limiting and resolves on its own, but again, in certain situations you may treat with sex steroids. Abnormal growth velocity is simply when patients or kids fall off the growth curve. The workup for this at the age of puberty or in those early adolescent years is a TSH, PRL, and an insulin-like growth factor.